Know this one?
Oh, yeah.
Little Rapper's Delight.
Yep.
This is where it all started.
That's where it all started, Mike D.
This is where it all started. Welcome to MedTech Jam Session with Chris and Mike D. I'm Mike Donahue. I'm your co-host.
Chris Lyons. Good to see everybody.
Hey, Chris, thanks. This has been fun. We were already having fun and we're just getting started.
Exactly.
Yeah. So like we do typically is you and I will riff for a few minutes, and then we have really excited about our feature interview today. Mark Foster, current CEO of CurvaFix. He brings a lot of experience and wisdom. He's been involved with a lot of both big companies and small companies and played a little professional baseball, a lot of fun stories to tell. But before we get into that, Chris, if you remember, you and I were at the MNVC, which, shout out Gary Stevenson, is a great meeting.
Yep.
In the investor roundtable, I thought there was, let's say, palpable frustration from a lot of the startup founders in the audience.
Yes.
Man, it's really hard to get started. It's really hard to raise that first $1 million, $2 million, that pre-seed money. You're really involved in the investor community. It's what you do.
Yep.
What is the current vibe right now for early stage entrepreneurs, maybe some surgeons that are out there that have a cool idea and want to get going? So what advice do you have? What's the current vibe?
So I would say the current vibe is definitely that things are going to be better in 25 than they were in 24, 23, or 22. However, it's still a bit of a slug to get there. I think that the challenge is that when you're raising a smaller amount of money, so let's call it south of 5 million, that the issue that a lot of people run into is just not having the right access points, not having the right family offices, not having the high net worth individuals, as well as even some of the angels, because in the VC realm, that's probably going to be a small amount for a VC to come in on. Most VCs, some will come in, as we'll hear about with CurvaFix, and put all of it in. And others will go, well, we'd like to syndicate it. And so the challenge is that how do you syndicate only $5 million? It's just not interesting enough at that level. And so
you have to do the same amount of diligence for a $1 million deal as you would for a $5 or $10 million deal.
Absolutely. Absolutely. And so there's a lot of companies and a lot of folks that have different ways of thinking about this relative to how do you do it. It takes a lot of shots on goal. The bottom line is that it is playing the odds. It is constant outreach. It's constant follow-up. Then you get those meetings, and it drives me crazy a little bit because I hear people say this all the time, and it's like, if you don't have an end to a VC or to this office or that office, don't even bother. I disagree with that. I think that you have to create the end instead of just sweeping them off to the side, because if they're a fit and you've done your research and you know their mandate and you know the space that they play in, you just got to establish initial credibility. That's one of the things that I do with all the clients is that I don't even involve them in the first phone calls or the first email introductions with the VCs. It is me, and I'm starting to build relationship. And I tell them what it's all about, and I tell them what we're doing from a fundraise standpoint, and I tell them all the different levels of monetary raise and even vehicles that we could discuss. And that sort of breaks the ice to where once it's broken and I've reviewed some of the clients that fit their mandate, then they're ready for that intro and it doesn't feel manufactured.
Yeah.
It's a good approach. It's a good approach that's starting to work really well. And the market opening up really has mattered a lot. So I just want to encourage everybody not to get downtrodden as it relates to just the amount of outreach. It does take more. But I also feel like it's going to start easing up a bit. Like we've talked in prior discussions, Mike, all the cogs, somebody finally found the WD-40 to move the cogs in this machine we call the healthcare medical device industry. And it's starting to loosen up.
Yeah. Yeah. It does feel that way. It does feel that way. We're recording this before we go out to the annual Academy of Orthopedic Surgery meeting and the Canaccord Genuity meeting. And so we're looking forward to hearing from both the big strategics and how they wrapped up 2024. Hoping that they have good momentum and that they are looking for new technologies. And speaking of cool new technologies, we're looking forward to speaking to our featured guest today. We played baseball. I wonder what his walkout song was when he was going up to bat.
It could be.
Is this what they played, Mark Foster, when you were coming up to bat or when you were coming off the out of the bullpen?
Yeah, this is definitely right down my power alley right here. I love it.
Little AC/DC.
Yeah. My kids hate it when this comes on because I can belt that out like nobody's business.
Yeah. Awesome. You heard it here first. You have a
You still got it, bro.
Mark Foster
Still got
solo.
Still got it.
Yeah, I can only sing the parts of songs that sound really odd. But thanks for having me, guys. Great segue, Mikey D.
Thank you. Thanks. Yeah, we were having so much fun doing this. And that's really what the jam session is. It's really just the three of us in this case, just jamming out on things we know about, love, and are interested in. And you've been around a minute. We're all kind of men of a certain age. And I think actually before we got on this, we were chatting about all our aches and pains.
Yeah.
We've probably all had a colonoscopy.
Boy, that's a good way to kick off the meeting.
This is
Hopefully
not
this podcast is not like a
Mark,
colonoscopy.
this won't be that.
Or even worse, colonoscopy prep. Sorry, but I digress. So, Mark, tell us, just first introduce yourself. Tell us a little bit about your history, your career, what brought you into CurvaFix. Take us to the Wayback Machine and give us a little bit of a history of Mark.
So I'm a native Baltimorean, diehard Orioles fans, Commanders, I guess is our name. I've been
Shout out.
Stick with those. The last couple of years have been worth the prior 20 of stinking. So that's good. Grew up down there, went to University of Richmond, played baseball at the University of Richmond, and went on and played in the Phillies organization for a little while, and then had an elbow problem and had to get a big boy job, as they say. So I was on our AA team in Reading and blew out the elbow and then transitioned there. And I really thought about what do I want to do? And the idea of medical sales was really appealing, bringing value to customers. I knew I'd land somewhere in the sales world, but was not energized by slinging copy machines and those types of things. So it started out with a pharmaceutical company called SmithKline Beecham. And as you all know, people either get into that world and love it or maybe quickly transition out. I put myself in the latter. I was there for a year and a half and really loved the experience, but was looking for a little more energy, which devices brought. Spent some time at Covidian, and then really 8 years at Boston Scientific, which were some of the best years of my career. Still a lot of friends there, really great culture. Learned how to walk and talk and chew gum and take care of customers. Was in the endoscopy division, and then went over and worked in the neurovascular division out in Fremont, California. Took more of an inside role in sales operations and customer service and business planning. And then was recruited by Todd Houston, who worked for Smith & Nephew, to go over to Smith & Nephew. Spent 9 years at Smith & Nephew. My last role there was managing the sports business, which was about a $600 or $700 million business. And at that stage, for a large company, as Mike, as we were there together, and Chris's experience at Medtronic, the career options are go maybe to a different international country, take on a little larger remit. And for me, it wasn't that energizing, the opportunity to go run a Europe business. But so I looked at the startup world. So I went to a startup called Trice Medical, which had a needle camera for in-office arthroscopy. And I think the drivers were, there's this whole separate closet of skill sets that you glean at these startup worlds, things like raising money, getting to an exit, managing cash, managing investors, managing boards, doing more with less, speed versus cash, all these different learnings, which for me felt like there's this separate closet of skill sets I had a chance to acquire. So went over there and really learned from someone that had a lot of experience in the space. I was there for about 7.5 years. Every chapter of the startup book, we had the ups, the downs, the lows, going through COVID and raising money and all that good stuff. So, but then towards the end there, one of our lead investor is a company called MVM, and they're a really powerful investor in the space. They asked me to help round out the diligence on this great product called CurvaFix to take a look at the commercial side. Did that, really liked the story, really liked the team, really liked the technology, and decided to jump over and have been here about 18 months now.
Awesome.
Fast. That 18 months has gone fast.
Yeah. What a diverse set of experiences. So I'm curious, what did you learn playing Division I in professional baseball? Is there anything that's carried over from a leadership perspective that sort of helped frame maybe your own personal purpose and mission, and also anything you learned from coaches along the way that kind of frames or informs your leadership style? Anything you can share there?
I'd say accountability. Ultimately, there's a scoreboard, right? Yeah, you can talk about, gee, it felt good, or we had a good call, or the momentum is building. But at the end of the day, there's a stat sheet and a scoreboard. And I think that's relevant to every business you're in, filtering through the story versus to the actual results. And so playing sports at a high level, you realize that sounding good or maybe looking good in the bullpen or looking good in BP don't really
Hmm.
matter unless you could put up the points when it matters in the environment that it matters. So I really enjoyed that. And also, I guess the hard work component. Obviously, there are some things within your control and some things not, but getting out of bed and working hard are firmly in your control camp.
Yeah. Putting in the hard yards. And you make a really good point. That's probably why you gravitated to sales, because sales also, you have a score sheet, you have a stat sheet.
Yeah,
Hit your number,
100%. Yeah.
or didn't you?
Yeah.
That's it.
Yep, it definitely feels relative to some fields in your control about earning opportunity and getting it done.
Right. Right. Well, I'm curious. Let's talk a little bit about fundraising, and then we'll jump into CurvaFix. You raised money for Trice, and you're probably in the process of raising money for CurvaFix at various stages. And I know you didn't mention it in your sort of intro, but I know you're involved at the board level with a couple of other companies. And
Yeah,
what is your advice for founders at, let's say, at a commercial stage, pre-commercial or commercial stage, not out of the garage, have something ready to go, maybe 510K approved. It's time to scale. And do you have to fund a channel or fund inventory? Tell us a little bit about your experience there and what has worked and what didn't work.
Yes. So when I decided to jump into that small business environment, I really wanted to get all the benefits of it. And for me, that also meant having a network in the space. As you guys both know, you're started this CEO sounding board, which is about 110 other
Mm,
CEOs in healthcare in the space. And the point was just sharing rapid information. As the CEO of a small startup company, sometimes you don't have a real network that's going through what you're going through. And of
mm,
course, there's no kind of woe is me. We're all very lucky to be in the roles we are, but there are a unique set of challenges that you share, and kind of everything from managing a board or figuring out how much equity you should give your CFO. So,
Mhm.
and I am on a few boards of companies that range from in market generating sales and profit to product ideas that have got a ways to go. And it is a very different sport raising under five, as Chris mentioned before, versus raising bigger checks. They're just two completely different processes, completely different pools, but the same process, which is quantity of activity. When I was raising for Trice, we were in looking for larger checks, so getting out of the family office space and into the more the VCs. But over the course of 4 or 5 months, I talked to 232 VCs
mm.
and kept a list of what is their check size. It is just dancing and trying to find a pool of investors that at least have an investment thesis similar to what you're doing. So, for example, you might find a venture capitalist that can't deploy under $100 million or can't deploy more than $500,000. So you really have to first make sure you're swimming in the right pool. Otherwise, you're spinning both of your wheels. So spend a lot of time managing the pipeline and the funnel. And I would say it's the exact same thing for these startups that are trying to raise $500,000 or $1 million. It's a wide funnel. I can't tell you how many times I've heard we're going to be able to raise 500 grand within a couple months, no problem. And it's like, okay, well, who, where, when?
Yep.
Like, give me the 100 names you're talking to, and where are you in the? It's a sales process. Where are you in the
Mhm.
process with them? Because until you have the money, you just don't, and
Yeah.
anything can happen along the way. So I guess my guidance would be, I think CEOs underappreciate the quantity of scale of amount of people you need to talk to find the right people with the right check size at the right time for their own either fund or personal situation. And it is just work.
Yeah.
100%. I can back it up. It's interesting because setting the right expectations for me with a lot of the different startups that are out there that are looking for the funding is probably the first battle, the first hill we have to take, because it's them understanding, look, diligence is diligence. And sure, it could be shorter with less money coming in or whatever the case is, but it's still a process. And if you're coming to me and it's January and you're hoping that you've got money in and closed by April, it's probably going to be a tough discussion, because it's just not that way. It takes time, and it takes relationship, and it takes trust. And to Mark's point, the more front end work you can do on vetting each other, meaning the investor and the company, the quicker you may get to money, right? That's the key thing, is being able to do that, because we have to look at both sides of the fence here. It's not only us as the startup world and the things that we have going on and the things we're trying to manage and all the different projects we want to launch if we raise this $20 million even, okay? And all the different things we want to do to grow the business. But it's also the fact that each one of these organizations have got just as many of us coming at them as they are at us. So it's just, you're juggling a lot of balls. There's no doubt.
Yeah, I agree. You got to have the right story. You got to have a big TAM. You got to have a good team. You got to have a good product. But it starts with finding people that are at least in the right zip code of investment towards what you're trying to do. Yeah. And that, even just getting to that step is a lot of work.
Yeah, for sure. Let's pivot a little bit and let's get into CurvaFix, your current company. You mentioned it earlier. You said you started off doing a little bit of diligence, maybe on behalf of an investor, and then you ended up taking the CEO spot. What was it that inspired you about the company? You said the team, the tech. What was it? All the above, a little bit of both? Talk a little bit about that.
Yeah, look, no job is perfect. No product is perfect. You try to de-risk these things mentally. And the things with this technology are completely differentiated. It's the world's first intramedullary nail for the pelvis. It's a curve fixation device, which we'll talk about in a second. So completely differentiated product, nothing else like it on the market. High ASP. The procedures are around $6,800 per ASP. The reimbursements are done and dusted. It's over $80,000 reimbursement. The procedures, tremendous patient marketing opportunity, particularly for the low energy pelvic fractures, which we'll talk about in a second. So you got a big market. The low energy market in the pelvis is, I would say, the largest untapped opportunity in orthopedics that I'm aware of. Today, there's only about a 10% treatment level for these low energy pelvic fall. And in hips, as we all know, it's 98% of hips, low energy. You treat them, you get them ambulatory. And the pelvic surgeons that are heavily involved in this space, like a Chip Browder or Claude Saji and Paul Ramans, are now coming around to the world that says, wow, this is an immobility issue. We need to fix it. So we got a great technology, differentiated, high ASP, good market, growing space, clear exit partners. There's clearly companies that are heavy into trauma that this could be a plug and play part of their product. And the product had enough cases in the market to justify. So, and the team just could not be better. I've never been around a stronger team at every position than we have, with the right culture and attitude. So all those things, and we're funded. We're funded for a few more years here with our current investors. So that's a pretty big list of like, check. Yeah. On the other side of it is risk and all the other things that we do in this business, but there were a lot of pros there.
Yeah, for sure. So now it's execution time. You made a pretty robust claim about the biggest opportunity, maybe the biggest opportunity, untapped opportunity in orthopedics. And I might agree with you, because there's not a good surgical solution for the geriatric fracture space. How are those patients being treated now?
Yeah, so there's 1.4 million pelvic fractures annually in the world. As I mentioned, 99% of hip fractures are treated. If you look at the high energy pelvic fractures, again, you're in that 80 to 90% treated because they have to. So for this one, think about a car accident, an explosion of the pelvis. Those are being treated at the level 1 centers. The difference is in the US, there's an incidence of disease of over 225,000 of these low energy. So this is your mom, your grandmom that trips on a hose in the garden and has a low energy fall. They go to the ER, says you have a pelvic fracture. We don't do anything with those. Go to the floors. They're on the floors for up to 9 to 10 days and they still can't ambulate. So they can't send them home. So they go to a skilled nursing facility. And the data on conservative management for pelvic fractures is exactly the same as conservative management for hip fractures in the 90s, which is 49% of these patients lose the ability to ambulate independently and up to 30% mortality rate out of 2 years. So really important to treat these patients, but there's been dogma over the years to the ability to treat them. As you can see behind me, the pelvis is a difficult anatomy. It's 3D. There's not a lot of physicians that are comfortable with it. What they have to do today is put straight screws in curved environments or plates. So it's hard to treat. And the fractures themselves aren't as visually impressive. They're these a little bit displaced but hurt like heck. So there's this kind of bias towards, oh, it's an old person, maybe they'll be okay. And again, the data, particularly coming out of Europe, is saying they do much better when they get fixed, the appropriate patients.
Mark, you and I know each other for a while, and I've shared this story with you, but you literally just described my mother's experience 15 years ago. And really, it sounds like it hasn't changed in 15 years, with the exception of CurvaFix.
Right.
She fell, fractured a pelvis, non-operative. Actually, she also fractured her proximal humerus, had a hemiarthroplasty, did great. But she had to go to a skilled nursing facility and laid in bed for 30 days. She was younger-ish, and she was able to ambulate. But then fast forward 10 years later, she fell again, had an intertroch fracture, put in a nail. The surgeon who did her nail said, I don't understand why she had this pelvic fracture too. I've never seen an injury mechanism where there was an intertroch and a pelvic fracture. And I was like, oh, that's an old injury. It sounds like that never healed. So she was walking around on an unhealed non-union for 10 years.
Wow.
Yeah. And I think there's recent data show there's an 18% risk of fracture progression as well from not healing these patients. So it is real, and it's unfortunate that she felt it.
Yeah.
So the technology, just to speak to why it really performs well in that patient population, it's a flexible IM nail. So very similar to nailing of the femur or other parts of the body. The components are held together by welded wires, as well as they're interdigitated, the individual beads. So there have been some other attempts at making flexible implants for other parts of the body. CurvaFix has really improved on the strength of those. And some of them, for example, were almost, you can think of pearls on a string. If you cut that string, the pearls come off. So all the beads are individual components. They're all tied together with the welding. And essentially the implant will go in flexible and then will be locked into its rigid form. And having a curved implant in poor bone in a curved pelvis makes it very difficult to unwind or back out. We've seen 0 to date of these implants backing out, which does happen with straight screws with these forces. And as you can imagine, it's just like being in your house. If you were to bang a straight screw into your drywall and pull it out, you probably could. If that wall goes in, if that nail goes in and turns, it's now much more difficult to pull out.
Yeah.
Absolutely.
Yeah, that makes sense. You framed it as an intramedullary device, so it's not a screw because it's got some threads on the end, but it's not really a screw. Do people get confused? Oh, this is a screw. It doesn't pull compression. That's not what it does, right?
Right. It does take a mind shift of understanding what we're doing. The product was developed by Dr. Bob Meek, who's a pelvic surgeon out of Vancouver. And pelvic surgeons know it's got to be strong. I got to be able to take it out. Everything has a chance to break. If it does, I need to be able to take it out. So it was really designed with those things in mind. And you're right, it's not a screw. It's an IM nail of the pelvis that does provide some compression. The elderly patients, generally speaking, it's more important the stability of the construct and the support, which is a straight screw, for example, in the anterior ring, typically a 3.5 or a 4.5 diameter in short distances, because that's all you can fit. Here you have a chance to put in a 9.5 millimeter or 7.5 millimeter 200 centimeter implant that really provides more support for the patient.
Yeah. So it sounds like it's a load sharing device, not a device to pull compression, but to share the load throughout in the
Sharing the
pelvic.
load, providing stability, tightening up the construct. And these pelvic fractures are complicated fractures. About 60% of our procedures might even have someone else's plate or maybe a straight screw in the back for some compression. You really have to fix the front and the back of the pelvis. And really good surgeons need lots of tools to do it.
Yeah.
When you think about this, Mark, from a standpoint of the awareness that you are newly creating because you have a problem that can be solved now relative to the nail, okay? What do you think the surgeon uptake is? You're living this by watching these new surgeons coming on board with you on a pretty regular basis and so on and so forth. Are they so wowed by what they're seeing that they're transferring that success into all their counterparts that could do some of the same procedures?
Yes. So this is I heard you guys open it up a little bit. My philosophy has always been each product is its own way to get to the market. And that goes everything from distribution channels to, are you direct, indirect? Are you this product is in a world where there's a very defined pool of world-class pelvic surgeons that are the tip of the spear of this business. So we spend time working with them, making sure that what we're doing is the right things, the right indications, the right training. But what I can tell you, Chris, is that there are two different worlds. There's the level 1 trauma center that is dealing with those high energies, the car accidents, your entire body is destroyed. And then there's these elderly falls that don't naturally go to those facilities. So it's an interesting dynamic because the physicians with the most experience of fixing the pelvis, today's market is a lot of those high energy. So those are the high energy physicians that really understand how to fix the pelvis. But then there's these other community level 2s or level 1 kind of community level 1s where we're seeing the low energy gravitate towards. And those physicians, quite frankly, have a little less experience doing pelvic surgery. And that group of surgeons in particular really feel like the implant has simplified the procedure, the ability to be a little less specific on your starting points. The guide wire takes a turn. So we think we're a great tool for the high energy, particularly in poor anatomy and fixing the front. And on the low energy, we've really simplified the procedure for those patients and surgeons as well.
Okay.
That's a good segue into my next question, which would be around, have you mapped out, have you defined the sales process for this? How do you take somebody from, who are you targeting specifically, and how do you walk them through the process of them becoming a user and then a future advocate of CurvaFix?
So we run our company on EOS process, and part of that process is identifying the target customer. And I think about this in a way that says, if you could have a group, if you wanted to hunt or fish in a pond, what would you stock in that pond to give yourself the greatest chance with our product? And our target audience are trauma trained, fellowship trained, 5 years out. So they have pelvic experience and they are looking to build a fragility practice. And so in those markets, these patients are coming. The procedure itself can be an elective trauma procedure that pays very well and is one that maybe doesn't have to happen at 6 a.m. on a Sunday. So you're able to manage these patients a little better for a quality of life of the surgeon. But our adoption process, and we've got an amazing commercial team led by VJ and Nicole, our head of marketing. Essentially, our sales directors are the player coaches. They're generating leads via their distributors. They're coming in, they're the experts. We'll do labs. So physician demonstrates interest, or we have a referral from one of their other friends. We use Sawbones Lab, which has really helped us avoid the cost of all the cadavers. So we'll come in, we'll do a Sawbones, we'll do a lab right there on site. And then we like to support those first 5 cases with clearly, obviously, our distributors, but also some of our direct personnel.
Well, ensure a good, successful, smooth first experience. How has going through the value analysis process been for something new like CurvaFix and in something that there's not a lot of experience people using a device for fragility, especially in the fragility fracture space.
Yeah, on that, one more question in that regard. It's to Mike's point, you're opening a new market in essence, right? On top of that, it's the way these value analysis committees think, which is not necessarily 21st century thinking, in my opinion. And how do you make sure that these guys, where there's really no competition per se for you, see this as a one-stop shop solution?
Yeah, so the value analysis committee is a real thing. I'm not going to say we're immune to that. That being said, if a surgeon is going to fight a battle, this is one worth fighting because there is nothing else like it. So again, the reimbursements are really positive. We've had cases, for example, where you have to go around hardware. As you both know, the periprosthetic fractures are just growing because more of these patients have implants in. So if they have a fracture and needs to go around an implant, the CurvaFix is a great solution. So we've got a robust VAC deck. Part of that VAC deck is a case study that was done at a level 1 trauma center in the Northeast. This surgeon had to justify the product, and essentially he looked at his low energy falls and did 10 CurvaFix. And what they found was that the average length of stay for the low energy falls was 9.8 days. The average length of stay for the CurvaFix patients was 4.8, and that included 3 days of evaluation. So that length of stay savings saved the hospital $7,000. In addition to that, the hospital not only just kicked them out towards a skilled nursing facility, they added an $80,000 profitable procedure. So we added a profitable procedure, reduced length of stay costs. And interestingly, of those patients in the non-treatment category, 75% of those patients didn't leave the hospital and go home. 75% went to a skilled nursing facility. 10 to 15% actually went home. And the CurvaFix patients was almost the opposite. So we're getting patients to go home quicker and ambulating quicker. So the story hangs pretty well for a value analysis committee that's looking to make an impact in their community.
That's great.
That's the story that I think that they want to hear.
Yeah.
Making a clinical difference. A, you're making an economic difference. B, you're saving the whole healthcare system, which all of us participate in. And as we all get older, we're going to be participating even more. So I think there's just goodness all around. One of the theories I have, and it'll be interesting to see, we won't know this for a while. These GLP-1 drugs, the Wegovy's and Ozempics, have been amazing for treating diabetes and for weight loss. The downside is there seems to be a problem with muscle mass and even bone density. And we saw this with Fosamax, with those drugs to treat osteoporosis, where patients would have to go on a Fosamax holiday. And then we saw fractures, specific fracture patterns we haven't seen before, with patients who took doses of Fosamax for a long period of time. I'm curious if we're going to see that 5 years from now, we're going to see an uptick in osteoporotic fractures.
Yeah, I've heard that from a few customers as a realistic. I don't have any data points on that for sure.
Well, I think it's too soon, but yeah.
But the other thing that you brought up yesterday too, Mike, is if you think about these fragility fractures, they're happening all throughout the body, obviously. And you're starting to see this separation of hardcore trauma, high energy level 1s. And yet, that business is, I'd say, flat year over year is what it is. But the increase of trauma procedures on these low energy fractures is going through the roof, not just in the pelvis, but also in the hand and the wrist. And you're seeing a bit of a separation of skill sets of those trauma surgeons as well. And some are gravitating more towards the community-based trauma versus the high energy. So it'll be interesting to watch.
Yeah, for sure. We used to joke in trauma that as long as people say, hold my beer and watch this, the trauma market's going to be attractive.
Yeah.
True.
Well, this was great, Mark. Is there anything else that you want to share about CurvaFix and kind of where you want to take the company and what's next?
We are riddled with ideas to expand the platform outside of pelvis. As you both know, there are many curved parts of the anatomy. So we're very confident. We've had a lot of rigor gone into the design of the product and are watching our data. So we feel like we've de-risked the implant design to the point where it's safe, effective, can be taken out. So that creates opportunities potentially to get into other markets. But really right now, the thesis of this company, we know there's a lot to do in the pelvis market to increase awareness. And that's where we're putting 98% of our energy for sure.
Yeah, one of the constraints of being in a startup is you are forced to focus.
Yes.
Yeah, you really do. It's just so easy to chase rabbits in these things, but then you got to really be thinking about the cash you've raised and is that going to return it in the timeframes that you want to get to. So
Yeah.
there is a web of decision making.
Yeah.
Yes. And potential distraction.
And potentially, yeah. And the CEO's job is really, I think, to evaluate options all over the place, keep the lens open, keep the aperture open on anything and everything, but be really disciplined about what you do.
Yes.
Not what you consider, but very disciplined about what you actually do and put money and time and resources towards.
Right. Absolutely. On that front, and I know as we're headed into Canaccord Genuity, which I know you'll be at presenting as well as the being present bodily at the AOS, the question I had is in the realm of the strategics that are out there with decent sized trauma platforms, let's call it, how do you communicate to them your fit, almost hand in glove, if possible, with their existing trauma platforms?
Well, I guess I would say my philosophy is how it's always been that the large companies, and particularly after being there, I was on Smith & Nephew when we did deals of ArthroCare and other businesses there. The large company is always changing. Leadership, strategy, initiatives. So I would recommend CEOs of companies like CurvaFix to just keep dripping on the appropriate people that run the businesses in parallel path that could acquire you, giving them updates on the technology. I'd say the right updates too. I don't think you want to be overly transparent on some of the things, but staying in front of them, telling them where you're going and what you're doing. And the reason is because their initiatives change so much. So one day they're in trauma, the next day they're in robots and AI and extremities or sports.
Yeah.
So you just have to be constant going down the road, and at some day hope that the mosquito hits the car. But stay consistent with your messaging and just don't think that, because you talked to them 2 years ago. It's like, no, every 6 months or so, there's different leadership changes. There's different initiatives. They have money. They don't have money. The stock's up, it's down. So just stay consistent and continually communicate with the people that should be hearing their story.
That's great.
So much of it is timing, and that's something you can't control.
You cannot control. And that is also a lesson for me. And we talk about that. Our team is so amazing. And we talk a lot about culture. And it's like, man, if we're only here to get out of here, then we did something wrong. You got to be enjoying the ride. You got to be surrounded by people that are energized and motivated. And we're lucky in that way.
Awesome. Well, where can people find Mark Foster?
You can find me on a plane somewhere in a Delta lounge. The website is www.curvafix.com. Follow us there. I'm pretty active on LinkedIn. Love to have you follow us there as well.
Awesome. Well, this was great, man. Thanks for joining.
There we go.
Here we go.
You were drowned out for a minute.
Yeah.
Thanks, guys. Appreciate you having me.
Yeah. Thanks for listening to this episode of the MedTech Jam Session. We'll see you on the other side.
Thanks, Mark.